What we're doing today is separating it sort of into two parts. The first part, Saba asked me to think about some of my research and how it might relate to the recent riots, what we've seen, what we've experienced, what can we learn from research, but equally, what can we learn from our organisations in terms of what's actually happening on the ground, and how can we sort of marry the two together for the sort of mutual benefit of all, really. So in terms of today, the first part, I'll focus a little bit about some research that I've conducted. It's in relation to domestic violence and abuse, but as we go through, hopefully you'll see how it links to this topic. And then really what I want to do is open up to yourselves to have a discussion. And because we're such a nice small group, actually, I'm hoping we'll be able to have some in-depth discussions as to your own experiences, what you've seen within your services, what you've seen within your services, and potentially think about ways forward as well. So I will put a disclaimer that I don't have any solutions, but I'm hoping that together we can all have this conversation and then think about, okay, have we got a potential list of recommendations that is an output of today's workshop? So it would be great in the second half if we could have that interaction. And really, I want to hear from yourselves as well. And just to say as well, part of the reason why we're recording is so that we can use what we learned from today to support the work of MMC, which is essentially to support the work of all the members of MMC as well. And even those who are not members, if we do have any non-members here today, the idea of how can we inform the sector as a whole. Okay, so let me just sort out my layout a little bit. So what I want to do is just introduce you firstly to a bit of research around this idea of securitized communities. What do we sort of understand by this term? What does it mean? What has research told us about it? And actually, I was pleasantly surprised when I looked into this to find that there is a little bit of work. There's still lots more to happen. But actually, in terms of a beginning baseline, we do have quite a bit of academic work that informs this. And the reason that's important, obviously, as service providers, you'll recognise, if we've got the academic literature, it means that then we can use that as a basis for informing policy, funding bodies, and that bigger, wider societal impact. So just to kind of give you a bit of an idea of what academia, what the research is telling us, I wanted to introduce you some of the terminology that's being used in academic papers. So we've got things like suspect communities post 9/11. That's the kind of term that's been given to Muslim communities. Counterterrorism, the whole counterterrorism initiative, and what's happened as a result of that, and how that actually exacerbates the idea of certain communities being suspect communities. Julian Hargreaves talks about this idea of state-sponsored anti-Muslim prejudice, which I thought was very, very powerful, actually, and something that a Muslim academic might not necessarily be able to say. So actually, that's a really interesting and important contribution. Both Abbas and Yunus talk about the idea of securitization of healthcare, and we've seen a lot of work around this, the idea that actually how able are individuals from Muslim and other minoritized communities able to access healthcare provision across the whole spectrum without the fear of actually it's going to end up as a security kind of issue, and it's going to be they're going to be perceived to pose a risk. And then we've got the idea of securitization being deliberately embedded into policies and practices. And again, that's across society as a whole. And what those policies and practices actually do, what that securitization actually does, is to favor white privilege. And therefore, in terms of the needs of minoritized communities, actually it's about social control and limiting social activism and movement. So essentially, those communities become restricted in terms of what they're able to do, the power they're able to exercise in society, and how they're able to access help and support for their own communities. So I thought it was really important just to give you that kind of backdrop that actually there are these conversations happening across academia. It's still quite a difficult area to work in, I'll be honest. It does come with its personal risk, and you can see why when you look at some of this language. But at the same time, the fact that this body of work does exist, I think is really encouraging. So in terms of my own research, So I do focus on forensic psychology. A lot of my work tends to look at different forms of abuse, and I come at it from lots of different perspectives. So yes, whilst I previously was a practitioner, I used to work with survivors of domestic violence and abuse. I also look at what's happening on the side of those perpetrating abuse and what's happening when practitioners are trying to work with those individuals, particularly in relation to minoritized communities. So as a result of one of my pieces of research, it was actually my PhD research, I developed something called the web model of domestic violence and abuse. And that was as a result of speaking to Muslim female survivors of domestic violence and abuse and practitioners who were working with them in a supportive capacity. So those practitioners worked in like a whole variety of roles. Some of them have dual roles. For example, some of them were imams and psychotherapists, to give you an example. Um, all of the practitioners were Muslim, apart from one. He was included in the study because he had about 20 years worth of experience of working with Muslim communities. So he had a really good understanding. And the research was funded by the ESRC. I'm going to literally jump into the deep end of what I found from that piece of research and then go through certain aspects to do with the macro level, and hopefully you will see how that ties in to today. So in terms of the web model, it's basically it's built on 4 levels. So at the center here, you've got the individual person. You're thinking about factors that are related to that person, what's specific to them in terms of psychological, social, and spiritual factors. Secondly, you've got additional stakeholders. So really, people who are significant in that person's life and in relation to the domestic violence and abuse. And that might be a positive significance, or it might actually be a negative and harmful significance. Then we've got the idea, the third level is intersectionality, so all the protected characteristics of that person. In addition to things like culture, for example, ethnicity, those kind of related areas as well. How does that impact on their experiences? So again, shaping how does it shape their experiences, and what does that mean for interventions? And then finally, it's the macro level factors, and that's really the area that I want to focus on today. That is actually the actual model. It's a bit scary looking, so that's why I started with this version of the model. But just to kind of quickly give you a brief tour of it, so that's the individual level. From here, from community leaders around all the way to extended family, those are the various stakeholders that I identified within my research, and it might differ for different people. The intersectionality is marked here. And again, so whilst it covers the protective factors, it also had things in relation to how well people understood domestic violence and abuse, their normative kind of cultural practices and faith. But the area that I want to focus on today is really this wider macro level, so the very edge of the model, the framework, and look at what does that mean. So factors at the macro level. So we're thinking about legislation, we're thinking about policies and practice, we're thinking about service provision, we're thinking about wider societal discourses, media influences, and faith identity. Now, they're not exhaustive, but those are the areas that came up within my research. It doesn't mean it's only limited to these areas. So anything else potentially that might go into there, into the macro level. So even thinking about, so we've got legislation, but political climate, for example, that might be another one to add in as well. And you can already see when you look at these 6, actually you can see the language that we were speaking about in the beginning in terms of what academia has found in relation to minoritized and Muslim communities in particular. You can already see how some of that language fits into these different areas. So what I'm going to do now is I'm going to talk you through each of these areas with an extract from participants who took part in my research to demonstrate that theme firstly, and to demonstrate their experiences at a macro level. And I think the key thing to kind of say prior to just going into that is this idea that when someone is going through something like domestic violence and abuse, now we don't need to limit it to that. We can think about other experiences, even in terms of just trying to access mental health support. When you're trying to access that support and you're part of a minoritized and stigmatized community, what happens to you in terms of what you're experiencing at the macro level? And my research found that those at the core of those experiences, basically, they had more barriers to engaging in support. And so this will unpack how that manifests and how that works. I'm just going to have to change my, okay. So in terms of legislation, we've got one practitioner who spoke about the police, excuse me, so this practitioner actually, he was the non-Muslim. So this was very interesting. He was talking about as social services, he was working with social services at the time. He talked about the pressure that as a service they felt by the police, that if there were concerns that were raised and that weren't necessarily about security, actually what they were seeing from the police was there was this real push towards why are they not making referrals towards the channel agenda, and that pressure on the service as a whole. So what that did was that then created a lot of fear in schools, a lot of fear in other agencies, a lot of fear within their own agency as well, within practitioners in their agency. So you've got this kind of collective fear being imposed onto different organizations and individuals within those organizations. And that's really interesting that as a non-Muslim, you know, that was his experiences, and this is what he was saying the climate was like. Whether or not it's changed, from my continued interaction with practitioners, I don't think it has changed. I think it just looks slightly different now, and maybe there's slightly different language that might be used as well. So this idea of when you've got that legislative kind of background, how does that pressure and influence services and the kind of provision they're expected to provide by other agencies as well? When we look at the policies in practice and service provision, so practitioner 4 spoke about this idea. So remember, she's a practitioner, and she was saying that you're a different color from everyone here, so you have to work that much harder to be recognized. And we're not even going to the individuals who access the services here. We're talking about the practitioners that work in these roles and that have substantial professional experience behind them. So this idea that they're having to work that much harder just because of the color of their skin, and the idea that they've got a place at the table, for example, that doesn't come without a lot of hard work and effort, more so than their white counterparts, basically. Practitioner 5 also spoke about the idea that actually, are we even collecting the right sorts of data? Do we even understand who our population group is in terms of who's going to access our services? Where is that data being kept? Most places, actually, it's not being recorded. So if you don't have that record, that means you don't actually know who you need to cater for, and then how you're going to cater for those different groups. So this idea of actually the whole recording process and how critical that is to service provision. But actually, if it's not there in the beginning, then it's going to impact the entirety of service provision. And obviously the commissioning of services as well. So we've seen, particularly across the domestic violence and abuse field, the idea that it's always the larger organizations that have the infrastructure that will be able to secure the funding. So the smaller organizations, which are really specialized, but they're very effective at their work, they don't have the larger infrastructure. So actually, to be able to access those funds, they don't have that infrastructure to be able to do that. So they're reliant on these larger organizations, but the recognition only goes to the larger organizations as well. So there's lots of different challenges there. Just move to the next slide. Okay, so when we then move on to wider societal discourses, practitioner 4 was saying this idea of how everyone, regardless of who they are and what their professional role might be, the idea that everyone, once one person from that community does something wrong, actually the entire community is tainted, and recognizing that if their white counterpart was to do that, then it's only that individual who's given that negative name rather than the whole community. So the idea that actually there's this collective kind of burden imposed on minoritized communities. And so that affects not just those who are trying to access services, but also those who are working in that sector. And that actually it can take its toll. It is a huge burden to carry. And the idea that it is a burden, it is difficult, it means that professionals are having to navigate these difficult spaces, whilst the individuals who are accessing the services are also trying to do the same. Excuse me. For those of you who've just joined, I have the freshers cold, so please excuse me. Okay. I'll just let you read this one. It's a little bit longer, and then I'll speak to it. Okay, so this extract was from Practitioner 7, and this kind of um, spans across several of the different themes, so several of the different levels of the macro level. So we're thinking about the media, we're thinking about wider societal discourses, we're thinking about faith identity and service provision as well. And the idea is, how are Muslim men perceived and projected within society? And there is a certain negative image that is projected in relation to Muslim men, or if someone even looks a certain way. So they might not necessarily even be Muslim. They might just be Asian or South Asian or ethnic minority, but they might have a beard. So based on how they kind of appear and their appearances, that has a real impact in terms of how they are then received into society, but also how they are received by service providers. And the idea that someone from this group trying to access support, or even the partner of someone or a family member of someone trying to access support, before they can even access their support, there's a whole array of assumptions potentially made about them. And that's not to blame those individuals who may carry those assumptions. Actually, it is the media, it is the wider societal discourses, it is the way that faith identity is projected in wider society that feeds into their thought process. And a lot of this, to be honest, is absorbed on a very kind of subconscious level. You won't even realize that those are the messages you're absorbing. And the idea that, so in order to access services, you have to fight this entire battle in terms of justifying your own identity and demonstrating that you have as much right as the next person to access services before you even almost put your foot in the door and speak to someone to get that one-to-one support. So again, recognizing the barriers that exist, and what does that mean for someone who's standing at that door who wants to go in and access support, especially say if we are talking about a victim of domestic abuse, for example. She is the victim in this case, she's wanting help and support. Then she's got all of these prejudices potentially, or assumptions being made, and she has to address those in some way before she can actually get to the real issues in regards to her own needs. And it's not just to do with domestic violence and abuse, it's across the whole sort of spectrum of service provision and accessing service. Faith identity. So there were kind of two elements to this, and one was the idea of the Muslim community itself, the evolving nature of a collective kind of identity. And, bearing in mind it's a post-colonial world, things are changing quite rapidly. The idea that communities individually and collectively are adjusting, readjusting, trying to find what their identity is, trying to understand what's going on for themselves, but they're having to do it in a very, very public space. So Practitioner 4 spoke about this idea of being caught in a vortex of change, but having the whole world watching that process. And obviously we know that when we undergo change, we're likely to make mistakes. Everyone makes mistakes, but that mistake is very, very public. So it's like being permanently under the spotlight, and every little thing that's done is potentially going to be a point of criticism by wider society. So within communities, there was the idea of faith literacy as well. So how much do people actually really understand their own faith? There was the idea of people trying to reclaim their faith identity. So going back to their scripture, going back to their roots, going back to their history, trying to understand it all and contextualize it all. And so what that would lead to was this idea of understanding and approaching faith in its holistic entity. But that journey is not a linear journey. It's got lots of roundabouts, it's got lots of twists and turns. But so you've got individual Muslims, you've got individual communities trying to regain this identity, whilst being put on center stage and being under the spotlight of the world, essentially. And alongside this was this idea that there are lots of externally imposed ideas of religion and faith, both within communities and external to communities. And so, whilst people are trying to grapple with their own identities, they're having all of these external identities as well, external ideas being imposed onto them. So, this kind of dual battle going on. And within that is this idea of how they are perceived by wider macro structures within society as well. So, the idea of there's so much going on for those individuals. So what happens, again, the question we keep coming back to is what happens when those individuals need to access mental health service provision? So then what happens when people are trying to seek help or seek justice? And practitioner 5, actually, he said that he felt what it did was it actually oppressed the Muslim male even more, which I found really interesting. The idea that, okay, we've got victims in this, but actually, ultimately, what it comes down to is that the Muslim male is oppressed more by those macro level structures. So, as a result of that, you're going to have internal conflict within families and within communities. And what's going to happen is those who really need the help and support, they're going to be blamed internally within their communities, as well as externally. They've got all those other pressures going on as well. So again, it's barrier after barrier in terms of accessing help and support. So just to quickly summarize, so from a survivor's kind of perspective, what we were seeing was isolation from social networks that was both internal and external to their own communities, minimal access to resources, fear of the unknown. So when they turn up to that service, how will those services respond to them? How will they understand them? What kind of perceptions or assumptions might they already hold? Not to say all services will hold negative perceptions. Actually, some services are very good at understanding and having that cultural kind of understanding. Fear of lack of adequate and culturally appropriate support. We did another piece of research within a grassroots organisation, and really that was a huge issue in terms of accessing mental health care. The idea that a lot of services just they weren't equipped. It was always the specialist services that were better equipped, but those specialist services didn't necessarily have the funding and therefore the capacity to support. The trauma of that person's individual experiences and then the collective stigmatized identities. So even if that person has, if they're just going for general sort of mental health support, the idea that they come from a stigmatized community, they've got all of that to deal with, even though actually they're just going for some very general basic support. And then the burden of blame, the idea that collectively everyone is holding that blame. The blame is placed on communities collectively. And so that's a lot of pressure across communities. In terms of service provision, the impact, so we can see there was a lot of pressure on services. A lot of that was to do with security. And if anything, it's probably got worse now. And obviously, as a result of the riots, we've seen some of the changes that have been introduced. They've also got issues around security of their own service provision and staff as well, especially if it's minoritized communities. So actually, our staff even just able to get into the office and provide the services. We heard of a lot of organizations having to board up their windows so that their premises wouldn't be damaged within the riots. The idea of it's not just those who are accessing mental health services who are having to think about their identities. Actually, it's the professionals and the practitioners working in those organizations that are also having to think about their identity and how they juggle that and how they navigate that professional landscape as well. And then essentially how to effectively support when factors are out of your own sort of control, and there's lots of things happening within society that are superimposed onto you. The other thing I did want to bring in was just my other work that I've done with practitioners and interacted with practitioners across different sectors. And there's a lot of fear around offending. So a lot of practitioners tell me the idea of, I really want to support, but I'm so worried I'm going to offend. I don't know what the right language is. I don't know how to navigate this space. I don't know if I'm going to say or do the wrong thing. And a lot of that fear comes from those wider societal messages. So you can see that almost collectively, everyone's being pressured in different ways. And that has a real impact in terms of what services then look like, and how individuals navigate that space as well. So that's just a bit of an overview of the research that I've done. And really, what I want to do now is to open up this space for us to have a discussion in terms of your service. What were your experiences at the time of the UK riots? What were you seeing within your services? How are you as third sector organisations now sort of managing the aftermath of that sort of environment? But also thinking about going forwards, what are your needs, what are your concerns, challenges, but also positives as well. Do we have any good examples here that we can share with anyone? And really, I want this to be kind of a collective learning experience, but also a bit of a safe space. And hopefully at the end of it, we can put together a list of recommendations potentially and hopefully circulate that a bit further.